After the 1988 earthquake, people from all over the world reached out to help Armenia. The disaster took away 25,000 lives, leaving hundreds of thousands homeless and destitute. In those days, aid relief from our compatriots living in the US, Archbishop Torgom Manukyan, Gevorg Hovnanyan, and Dr. Edgar Housepian reached Armenia. The aid would later be remembered as the first humanitarian aid to Armenia by the Fund for Armenian Relief. Since then, the Fund for Armenian Relief has implemented more than 300 humanitarian projects in Armenia and Artsakh. For 25 years, medical programs were headed by Edgar Housepian, clinical neurosurgery professor in Columbia University Medical School, vice president of the Fund for Armenian Relief. During those years, Dr. Housepian met and became friends with the first Minister of Health of our newly independent republic, Professor Ara Babloyan. Together, they initiated a number of innovations aimed at the development of healthcare in our country. Edgar Housepian would never raise his voice. He always spoke softly, but clearly, confidently, and imperatively. The imperativeness came from the fact that he justified the necessity and continuously followed that the necessity was brought into life and was implemented. It was very typical of Edgar. According to Edgar Housepian, the help to the motherland should not be only material. He wanted to see such a generation of doctors here that would not lag behind their international colleagues with their professional skills and knowledge, and what's more, would be able to educate others coming after them. For this very purpose, he organized the training of around 100 Armenian physicians in the United States and gave the idea of continuing professional development. Edgar talked a lot about continuing medical education, which we can say remained with us as a legacy from him. And when I was in the National Assembly and headed the Healthcare Committee, we set out to establish continuing professional development in Armenia by force of law. And then, as a gratitude to the great professor, a new neurology and neurosurgery service was founded in Arabgir Medical Center and was named after Professor Edgar Housepian. In the field of pediatric neurology, and in particular epileptology, new opportunities were created for our leading specialists to develop other fields of neurology and neurosurgery, the main goal being the introduction of the epilepsy surgery in our country. It is because 30% of 3,600 patients registered in epilepsy follow-up care are drug-resistant, and half of them need to undergo a surgery.
Մինչև 2014 թվականը մենք համագործակցում ենք տարբեր
Until 2014, we cooperated with US, Canada, and some European countries. But from 2014 to 2016, we sent 6 patients to the University Hospital St. Ivan Rilsky in Sofia, Bulgaria, where we underwent successful surgeries. Inspired by those results, we decided to have the same treatment method in our country as well. Since 2016, 32 patients have already been operated, most of them successful. In the beginning, those surgeries were performed once a year with the presence of Bulgarian colleagues, but now our neurosurgeon performs most of the operations by himself in Armenia. The outcome of surgeries depend on proper pre-surgical examinations, which are possible to perform with high-standard equipment obtained thanks to our generous sponsors and partners. Starting from 2015, the team performs 24, 48, and 72-hour electroencephalographic video monitoring, which is an important test to diagnose epilepsy correctly. In 2021, For the first time in Armenia, specialists from Arapgir Medical Center performed the WADA test, the purpose of which is to determine the dominant brain hemisphere before the main epilepsy surgery in order not to damage the memory, speech, and motor areas of the brain. At the beginning of 2022, deep brain stimulation became a reality in Arapgir, which is used to treat movement disorders, including Parkinson's disease. It was performed for the first time in Armenia.
Զուգահեռ մենք ձեռք բերեցինք Edgar Housepian-ի
With the help of Edgar Housepian Foundation, we acquired a compound device called LexiFrame, through which we are going to introduce stereo EEG in near future, which is considered to be a high-level test in epilepsy surgery. Even today, with that device, we can perform surgeries on patients with movement disorders. By now, we have 2 successfully operated patients, a child and an adult, for whom this operation was the best solution because no drug could treat them.
Այդ վիրահատությունը պացիենտների համար կրկին փրկություն էր։
And just like this, step by step, the Neurology and Neurosurgery service of Arapgir Medical Center is expanding, with the multidisciplinary team making efforts for patients' health and life quality.